How is laparoscopic surgery performed for diverticulitis? Imagine a tiny camera guiding a surgeon through the inside of your abdomen to fix a problem. That's what happens during laparoscopic surgery for diverticulitis, a minimally invasive way to treat infected or inflamed parts of the colon. The goal is to remove the diseased section, usually the sigmoid colon, which is the most common site affected by diverticulitis. The procedure starts with you under general anesthesia, meaning you're completely asleep and pain-free. The surgeon then makes several small cuts in your abdomen, often less than an inch long. Through these tiny openings, they insert a laparoscope, which is a thin tube with a camera attached. The camera sends live images to a monitor, giving the surgeon a clear, magnified view of your internal organs. Next, the surgeon carefully frees the affected part of the colon from surrounding tissues, a process called mobilization. This usually begins with the descending colon and moves toward the splenic flexure, the bend near the spleen, to ensure enough length for safe removal and reconnection. The blood vessels supplying the diseased segment, such as the inferior mesenteric artery and the left colic artery, are then carefully tied off or sealed using specialized devices. This step controls bleeding and ensures the healthy parts of the colon continue to receive blood flow. Once the diseased segment is isolated, the surgeon cuts the colon above and below the affected area. Sometimes, part of the colon is brought outside the body through one of the small incisions to make precise removal easier. The healthy ends of the colon are then stitched or stapled back together inside the abdomen in a process called an anastomosis. Before finishing, the surgeon tests the connection for leaks to make sure it's secure. Throughout the operation, the surgeon is cautious to avoid injury to nearby structures like the ureters, blood vessels, and nerves. If infection or contamination from the inflamed or perforated colon is present, the surgeon may perform a washout, cleaning out the abdominal cavity to reduce inflammation and infection. In cases where the infection is severe or the colon cannot be safely reconnected immediately, the surgeon might create a temporary opening called a colostomy or ileostomy. This diverts stool outside the body into an external bag, giving the colon time to heal before a future surgery to reconnect the bowel. Compared to traditional open surgery, laparoscopic procedures usually mean smaller scars, less pain after surgery, faster recovery times, and shorter hospital stays. However, not everyone is a candidate for this approach. The severity of diverticulitis and your overall health will influence whether laparoscopic surgery is suitable. In summary, laparoscopic surgery for diverticulitis involves making small cuts, inserting a camera and instruments, freeing and removing the diseased part of the colon, reconnecting the healthy ends, and possibly creating a temporary stoma if needed. The aim is to eliminate the infection and inflammation while reducing trauma and speeding up recovery. If you're considering this surgery, it's important to discuss with a qualified colorectal surgeon to understand the risks, benefits, and what to expect based on your specific condition. Always seek personalized medical advice from healthcare professionals to ensure the best care for your health.